Hello everyone, and welcome to Tender Loving Care Training Academy, and today we will be talking about the signs of heart disease in a person. Our heart pumps blood non-stop 24/7 throughout our lives. In this video, we will not talk about the specific problems themselves, but take a look at what signs and symptoms these problems might present with. This will help you be more vigilant regarding heart diseases and identify them early on. So, keeping that in mind, let's start with a simple question. What is heart disease? What is heart disease? Heart diseases are one of the leading health risks humanity faces today. According to the American Heart Association, more than 1 in 3 adults suffer from heart diseases. And according to WHO, around 18 million people die each year from heart diseases, which is an estimated 31% of all the deaths worldwide. Here we must clarify one thing. Heart disease is an umbrella term. It includes diseases such as heart failure, coronary artery disease, arrhythmias, and other heart-related infections, irregularities, and birth defects. Now, seeing that the heart plays a very crucial role in survival, it may seem that something so serious should have warning signs. But that is not the case. According to the CDC, 50% of people who die from coronary heart disease didn't even know they had it because of a lack of symptoms. It's possible to develop heart disease without knowing it as you go about your daily life. So, it's important to know the early signs of heart disease as well as the risk factors so that you can get treatment early and prevent more serious heart problems. Let's first talk about what are the risk factors for developing heart diseases. Risk factors for heart disease. According to the Center for Disease Control and Prevention (TD), nearly half of all Americans, both men and women, have 3 or more risk factors for heart disease. Let's take a look at few of these risk factors so that you can modify and control them if possible. 1.in. Growing older increases your risk of damaged and narrowed arteries and weakens your heart muscle. 2. Gender. Men are generally at a greater risk of heart disease. The risk for women increases after menopause. 3. A family history of heart disease increases your risk of coronary artery disease, especially your parent developed it at an early age. 4. Smoking is a very important and modifiable risk factor. Nicotine tightens your blood vessels, and carbon monoxide present in the cigarette smoke can damage their inner lining, making them more susceptible to atherosclerosis. Heart attacks are more common in smokers than in non-smokers. 5. A poor diet is also a risk factor. A diet that's high in fat, salt, sugar, and cholesterol can contribute to the development of heart disease. 6. Uncontrolled high blood pressure can result in hardening and thickening of your arteries, which leads to narrowing of the vessels through which blood flows. 7. Levels of cholesterol in your blood can increase the risk of plaque formation and atherosclerosis. 8. If you have diabetes, this also increases your risk of developing heart disease. Both conditions share similar risk factors, such as obesity and high blood pressure. 9. EPs is also a risk factor. Excess weight typically worsens other heart disease and also increases the risk of developing atherosclerosis. 10. Physical inactivity and lack of exercise are also associated with many forms of heart disease. Excessive stress also leads to damage of your blood vessels and worsen other risk factors for heart disease. A combination of risk factors may also signal impending heart disease. For example, your risk of heart disease significantly increases if you have diabetes and high blood pressure. Signs of heart disease. Early signs of heart disease. Usually there are no signs of heart disease. It often presents unexpectedly in the form of a heart attack or other serious event. But there are few important signs that can help you to recognize heart problems before they become serious. In the early stages, symptoms can develop that seem like mere annoyances and may come and go. For example, you may have heart arrhythmia, which is basically an irregular heartbeat. you can experience difficulty in catching your breath after moderate physical exertion, like walking up a flight of stairs. You can develop a sense of discomfort or squeezing in your chest that lasts for 30 minutes to a few hours unexplained in your upper torso. Neck and jaw is another early symptom. A heartbeat that is faster, slower, or more irregular than usual can also be the presenting symptom. You can also experience an episode of dizziness or fainting. Heart diseases that involve your blood vessels are often signaled, and chest pain, aka angina, shortness of breath, extreme fatigue. Irregular heartbeat. You can experience symptoms in your hands and feet such as tingling, numbness, coldness, and weakness. These symptoms can be signs that your blood vessels have narrowed. This narrowing, which can be caused by plaque buildup, makes it more difficult for your heart to circulate oxygenated blood throughout your body. Similarly, heart disease caused by an infection of the heart can include symptoms like free shortness of breathness or fatigue, swelling in your legs or abdomen, changes in your heart rhythm, dry or persistent cough, skin rashes or unusual spots. Signs of a heart attack. A myocardial infarction. A heart attack occurs when heart disease has reached the point where blood flow to the muscles of the heart decreases. It becomes so low that the heart is unable to meet the energy demands of the muscles of the heart itself. The most common sign of heart attack is chest discomfort that includes tight squeezing, intense pressure on your chest, which may or may not be associated with chest pain. This discomfort may also be present in your arms, back, neck, abdomen, or jaw during a heart attack. You may also have shortness of breath, profuse sweating for no apparent reason, tonsure, and lightheadedness. Knowing the signs of a heart attack is one of the most important things you can do to safeguard your cardiac health. Your ability to recover from one of these events depends on how quickly you receive treatment for them. It can be difficult to determine if you're experiencing symptoms of a heart attack. Never ignore symptoms as normal. Always seek immediate medical attention if you're concerned about any symptoms you have. It's crucial to reduce your risk factors for heart disease, whether you have symptoms or not. Schedule regular checkups even if you think you're in excellent health. Establishing a baseline for your health will help you and your doctor address any concerns that arise in the future. Reducing risk factors and modifying your life habits go a long way in decreasing your risk of suffering from heart disease and also lessens the impact if you already have one. So friends, with this we come to the end of this video. We talked about the various signs and risk factors of heart diseases. This is a series of videos about signs and symptoms of various diseases of our body. Comment in the section below. If you like what we do, support us by sharing this video with someone who you might think find it useful. Thank you so much for watching and stay safe.